Hey, what's going on, guys, and welcome back to another video of Keep It Simple Stupid. Today we're going to be discussing the difference between a peak pressure and a plateau pressure. And specifically, we're going to discuss what they mean and how they're different, and of course, we're just going to make it simple. All right, so let's go ahead and get into it. So first things first, I think it will be helpful to discuss what you'll need to be seeing on a vent to better understand peak pressure and plateau pressure. Now, the first thing you'll need to understand, right, is that if you're measuring these two values, it's going to be on a patient who is intubated and mechanically ventilated. Now, the important thing is that on the actual ventilator itself, you will see a graph that kind of looks like this. And this is a very simplified version, but essentially on the y-axis, it's going to be measuring airway pressure here. And then on the x-axis, you're going to be measuring time. Right, and you'll see one for flow and then one for pressure. But for today, we'll just be focusing on pressure. So for pressure, what you'll see is these spikes, all right, that I've kind of drawn out there in that orange color. And basically what you're looking at, and this is an example of a normal one, is that you see the pressure going up when the ventilator delivers a breath. And if you think about it, it kind of makes sense that vent is pushing air in, and then as it releases, it's given the breath, right? Everything's kind of relaxing, that pressure goes down. Now we're going to go ahead and get a little more advanced here. So say we're still looking at the ventilator monitor, and we're looking at the pressure over time. Now, one thing that can be done on a ventilator is something called a breath hold. So basically, what is that? So the vent gives a breath, right? And then you'll see this flat area, which is your plateau. This portion represents the breath hold. And that kind of makes sense because instead of the patient going into exhalation after receiving that breath, you're holding it so that those pressures stay elevated. So now that we have a better understanding about what normal looks like in the example of a breath hold, let's go ahead and discuss some of the pathology that you may see when you're on the ICU or you're in the emergency department. So first things first, it's important to understand, we know that this is your plateau. Okay, and then before that plateau, this represents your peak. So you think about it, that peak comes first, and then after that is your plateau. And again, this makes sense because the peak is going to be the highest point on the monitor there. Okay, so now that we have a better understanding of what a peak and plateau are specifically, let's go ahead and discuss some abnormal findings. Now on this example right here, this actually is an example of an elevated peak pressure. And the question is, okay, well, how do you know that? So the actual definition of an elevated peak is that when the difference between the peak and the plateau is greater than 5 millimeters of mercury, you know that you have an elevated peak. And then a little later on here, we'll discuss what that actually means. But just remember that you have that difference between the peak and the plateau, greater than 5 millimeters of mercury, you have an elevated peak. Here's another example, and you can probably guess if we just discuss what an elevated peak pressure looks like. This example represents, I'll let you guess, we know there's an elevated plateau. I mean, for one, just looking at it, look how high that plateau is. But to get specific and fancy, an elevated plateau pressure is going to be greater than 30 measured on our pressure. So if you can imagine, we'll say the 30 cutoff is right here. You can see that this plateau is clearly higher than that 30 baseline. So this will represent an elevated plateau pressure. So now that we understand what they look like on the actual ventilator, I think it's important to understand what elevations in these values actually mean. So you can see here on the left, I have a very cartoon example of lungs here in green, and then you're going to see the airways in blue, and then you're going to see the ET tube in black that connects to the ventilator in orange. Now, the important thing about a elevated peak pressure, what that tells you is that you have an elevation in the resistance in the actual airways, right? And that's why I drew out in this example blue for the airways. So what could cause an elevation in resistance in the actual airways themselves? So it could be a bronchospasm. It could be secretions, right? Because you could, if you think about it, you could have like some secretions that are blocking up part of the bronchus. It could also be something like a mucus plug, or the actual ET tube tip itself is occluded. So remember, elevated peak pressure is looking at the actual airways, and when it's high, it means there's an increase in resistance. Now let's go ahead and think about plateau pressure. So what does an elevation in that plateau tell us as clinicians? So the important thing to understand is that the plateau pressure actually looks at the compliance of the lungs here in green, right? And if your plateau pressure is elevated, that means your lungs are less compliant. Now let's think about what are things that can make your lungs less compliant. And by compliant, I like to think about it in my head as like, how stretchy are those lungs? How well can they open and close? And what are some examples of things that could decrease the compliance of a lung? Well, one could be a pneumothorax, right? Say you have an actual lung that's collapsed. It could be pulmonary edema. There's fluid filling those alveoli and they're having trouble opening up and closing. It could be ARDS, or it could be something like pneumonia. So in summary, just remember an elevated peak pressure is telling you that there's an increase in the resistance of the airway. And I listed out some common reasons that could be the case. And then also remember that an elevated plateau pressure is looking at the actual compliance of the lungs themselves, and that an elevated plateau pressure is telling you that there's a decrease in the compliance of the lungs. All right, guys, well, that's all I have for you today. I hope that was helpful. As always, like, comment, subscribe, and if there's any specific topics you'd like me to cover in the future, please let me know, and I'd be more than happy to make a video. All right, guys, see you next time.